My name again is Sandra Godoy. I am an outreach counselor with Star Texas Health Step. We do all the education and enrollment for Medicaid, which would include our children's Medicaid, pregnancy Medicaid, disability Medicaid, which is our Star Kids. Star Plus is our SSI disability adults. We also do dual, which is the Medicare, Medicaid recipients. And so we do the education and outreach everybody so that they can understand what Medicaid covers as well as some of the requirements. So I'm going to go ahead and share my screen. And you should be able to see that.
Yes.
Okay, thank you. So what we're going to learn today is about the healthcare orientation, which is one of the requirements for Medicaid. So this is for newly certified children that are on Medicaid. You're going to learn about the benefits and the services ready for use by Medicaid recipients, birth through age 20, which is called the Texas Health Step Checkups. Attendees will learn about how Medicaid recipients join a medical and dental health care plan. That's where our outreach comes in for all of our outreach counselors. And we're going to talk about that. The general Medicaid facts, what Texas Health Steps are, and the benefits of the Texas Health Steps, and of course, the responsibility of the recipient and the parents. Note Medicaid simplification is for children under age 19, but the Texas Health Step program is required for anybody that is under the age of 20. So just a little bit of information. How do you get your healthcare orientation? If you're not outreached by one of the outreach counselors, you can always call for Texas Health Steps, 1-877-847-8377. Pre-COVID, we used to do home visits, which you could request, and we would go out and visit you at your home. Of course, with COVID, we're not doing that, but we would definitely give you a call. And then you can also reach us at the website, which is www.txmedicaidevents.com for dates and times. Again, right now, because of COVID, we're not going out and doing our events, but that would be the website. And then in managed care, we're going to talk a little bit about that. So what the healthcare orientation does consist of, and just let me know if I'm going too fast or if somebody has a question in the chat, I'll slow down. The healthcare orientation, again, is required by the Medicaid recipients. It includes facts on the general Medicaid program. You should not receive a bill if you're receiving Medicaid. Who pays the health services? The renewal through mail. Look for the renewal letters from HHSC. The Health and Human Service Commission usually does their recertifications anywhere from 6 to 12 months. They do send you a letter. For those of you that have the website, you can actually check your correspondence and when those notices were mailed out so you don't miss the deadlines on getting that recertified, the recertification. Also, the orientation does include the traditional Medicaid. So everybody on Medicaid is on traditional until they get enrolled in their STAR or Medicaid managed care and children's medical and dental services. The main enrollment hotline or helpline rather is 1-800-964-2777. And that's available Monday through Friday, 8 to 6. Enrollment in a medical plan to pick a main doctor. The outreach counselors do help assist with that, especially if somebody doesn't know a doctor. Enrollment in a dental plan to pick a main dentist. And then of course our Star Plus, Star Kids, and Star Health. So healthcare orientation also includes the traditional, oops, I already did that one, let me go back. A client in the Medicaid service delivery system, age 0, starting at birth through age 20, traditional Medicaid, managed care, which is Star, Star Plus, Star Health, children's Medicaid and dental services. And these are all Medicaid services that are approved by HHSC. DFPS, which is our adoption assistance or foster care, and then also the Social Security Administration. So these are all parts of Medicaid that our outreach does service. Goals of this program today are going to be to emphasize the early detection and treatment of medical and dental problems for our children, to link recipients with primary care providers who can meet future healthcare needs, link recipients with a main dentist, emphasize regular checkups for infants and toddlers, and reach more teens. So that is the goal of healthcare orientation and also our outreach counselors. The purpose of our outreach is to educate the Medicaid clients about the benefits and the preventive health care for children, join a medical and dental health care plan, urge Medicaid clients to use Texas Health Step benefits and services, and to help Medicaid clients in using the services and overcoming barriers to participate. And I'd like to go over that in just a little bit with you, because that is a big one. When we miss the call and can't get a hold of them, a client doesn't receive the education, and sometimes they don't know everything that Medicaid covers and some of those responsibilities. So we try real hard to outreach. We are involved in the community through participation in interagency meetings, health fairs, and presentations at schools, Head Start programs, and other community events. Right now, of course, it's mostly Zoom because of the pandemic. Hopefully we'll be out in the community soon. Employ targeted outreach to families needing healthcare orientation, teens or parenting teams, migrants, and other identified population with phone calls and home visits. How do the clients access services? If you're approved for Medicaid, these are the services that you can. If you're approved for Medicaid, you receive your Texas Medicaid card, checkup reminders and letters, outreach and informing services from central office and regional staff, and then of course the Texas Health Step toll-free line. So these are some of the ways that you can access those benefits. So when you get certified for Medicaid, you will receive a Medicaid ID card that looks something like this, and that you should take to all of the doctor's appointments, as well as dentists if the child is under age 20 or under. 21 over does not qualify for dental. There are some healthcare plans that do offer some dental, and that is limited. But for the norm, the Medicaid doesn't cover dental for anyone that's 21 or over, but children do. And I'm going to go ahead and pause before we go on if anybody has a question. Okay. So the Texas Health Step Checkup is a preventive program that is required by Medicaid. It's for children starting at age birth that are on Medicaid through the age of 20. It is a health and developmental history, nutritional screening, developmental screening, autism screening, mental health screening, tuberculosis, and then the physical exam is the measurements, oral assessment, vision and hearing screening. What happens during the Texas Health Step? Also, they'll get their lab tests, immunizations, dental referrals beginning as early as 6 months old. So those little babies without teeth that are 6 months old do have that first dental checkup at 6 months old. Sippy cups, sweet drinks, pacifiers can affect the growth of the teeth. So that is one of the requirements. And then referrals to other service providers. So the doctor will, recommend if there's other services that needed. The periodic schedule for the Texas Health Step is usually when the baby's born. They do the first one usually in the hospital or within the first 5 days, and then they get a schedule. It's a 2-week checkup, a 4-week checkup, and as the baby gets a little bit older, the schedule gets a little bit more spread out. Once the child turns 3, it's once a year. The month of their birthday, on or about no later than 2 months after. And then the recipients do get a little wallet card for the babies, and I thought I have one here. So that way, when if they forget, they do have the little wallet card that fits, you just fold it up and it has a little schedule. It's very easily attainable. And if any supplies are needed, I can definitely leave those with Ms. Hess. The dental service checkup, again, starts as early as 6 months old. They'll keep happening every 6 months. So whereas the medical over 3 is once a year, the dental is every 6 months. More frequent dental checkups for children 6 to 35 months of age if needed. The services do include, for the Texas Health Step, cleaning and examinations, sealants, oral health education, follow-up services as necessary, orthodontist if medically necessary. So braces are not included unless it is medically necessary. And then, of course, the emergency services at any time, no referral is needed. I do get the question a lot about, well, I took my child to the dentist last month, but it may not have been a Texas Health Step. So it's real important for them to emphasize when they schedule that appointment that it is for Texas Health Steps. So only go to the emergency room. We try to emphasize this, especially with COVID. When the child is in sick or pain, parents usually know when their child needs to go to the emergency room. All of the healthcare plans do have a registered nurse line available 24/7. So if they cannot wait for somebody to get back, of course, get to the hospital, call 911. Emergencies include a problem or condition including severe pain that is so severe that waiting for routine care might result in serious harm. In an emergency, you might not have time to call a primary care provider or main doctor. So in that case, call 911 or get the child to the hospital, or of course the adult if they're on Medicaid. If it is not an emergency, they should call their doctor first. Medical transportation. When a person is on Medicaid, Medicaid does help with transportation. If they do need a ride, Medicaid can provide a bus pass or some other type of service. However, if they drive their own car or if somebody drives them to and from the appointments, the doctor, the dentist, or the pharmacy, they can actually get reimbursed for their gas. So that's a big help for some of our recipients. If there's an out-of-town visit that requires an overnight stay, hotels, meals, and gas can be covered. So we have had situations where maybe a child had to have a procedure done, could not get it done in San Antonio, so they were referred over to another city. That trip can be reimbursed or paid for by Medicaid Transportation Department. And most of the clients will receive a little brochure. I'm going to see how close I can get this in their packets that has the instructions, has the toll-free number, both English and Spanish. And then it is important to know that when they are scheduling a ride, it's only for the recipient who has the appointment and the caretaker. So they have 3 or 4 kids that don't have an appointment, they'll need to find some kind of day sitting or daycare for them because they will not be allowed to go on that trip. And again, I know with COVID, most of the doctors are suggesting that anywhere, not letting anybody else in other than the parent and the child. And then for a ride, usually call 2 to 5 days ahead of time. When I'm doing my presentations to my one-on-ones, I usually tell them to call during the week, Monday through Friday, 8 to 5, so they can get the information and feel comfortable with it instead of waiting until they need it. That way they kind of understand what it is, and the transportation department can actually, go over that with them a little more detailed. And then here's the number to the Medical Transportation Services, 1-877-633-8747. And then, of course, the websites. Ms. Hess is recording this, so this will be on y'all's YouTube video. Now, case management is a service provided for pregnant women and for children who may have a little more complex medical issues. For pregnant women, it could be gestational diabetes, high blood pressure, poor baby growth, even if they're having problems at home, feeling overwhelmed or anxious. For children, it could be asthma, ADHD, problems at home or at school. A case manager could assist, a person called a case manager, with any medical, dental, educational, financial, community resources or equipment that might be required. Sometimes the doctor would recommend this, but if they feel they need it, they can always call the toll-free number, and I'll get that as well. I think it's on the next slide. And as we do our outreach, we do have a list of the providers in case somebody, while we're talking to them, says, yes, I need that service. Right then and there, we'll go ahead and get them connected to a case manager. So if the family already has chosen Texas Health Step medical, dental, or case management provider, we are ready to help them schedule a visit to their doctor, and we can help schedule that for them. The importance of keeping the scheduled visit or calling to reschedule the visit is also emphasized. So we do, tell the clients about the emergency services, and then yes, if they have to cancel an appointment, once they've scheduled it, to please do that within the 24-hour time frame. That'll just make it easier for them to schedule the next appointment. Other resources, CHIP, which is if children don't qualify for Medicaid based on the income bracket, it'll possibly revert to CHIP, which is low-cost health insurance for children. Sometimes there's no fee up front. Sometimes there's no copay or no deductible. In some cases, it might be a fee of up to $5 for prescriptions, $50 one-time enrollment fee, and then sometimes, like I said, there is a small deductible. And then there's the website for CHIP. And now I don't see the number to the case management, but let me go ahead and give that right now. It's 1-877-847-8377, and I have put that in the chat. And you would ask for the special service unit. You know, a lot of children right now with COVID are experiencing some anxiety, being at home, not being able to see their friends. So definitely can give them a call. WIC is another service. If a child is on Medicaid under the age of 5, they qualify for WIC. Pregnant women who have Medicaid can qualify for WIC. So we do automatically give them that referral to WIC. We give them the telephone number, the toll-free number, and also the website, which is www.texaswic.org. And then the toll-free number is the 1-800-942-3678. So we do encourage them to take their ID, picture ID, verification of their address, and then their Medicaid ID number for either the child or themselves if they're on pregnancy Medicaid, because that will show that they are eligible for that program. So Medicaid managed care. So let me kind of break this down for you. When a person wants to apply for Medicaid, there are several ways they can do that. They can do it online at www.yourtexasbenefits.com. They can fill out a paper application, and then they can also fax an application to the Health and Human Service Commission. So once the Health and Human Service Commission determines that they are eligible, then the enrollment process begins. And so that's when we get the referral. If it's for the pregnancy Medicaid, that is our priority. And then the children's Medicaid. Everybody on Medicaid has to be on a STAR plan. If they want to or don't want to be on a healthcare plan, they do have to send in a letter as to why. And then that's up to the state to decide if they can be exempt from being on a healthcare plan. There are several advantages, though, to being on a healthcare plan. For the adults, it gives them access to unlimited prescriptions, whereas on regular Medicaid, it's 3 prescriptions for anyone that's 21 or older. And then, of course, the healthcare plans do provide what is called value-added benefits. These are gifts or perks for that person, and they offer different things. So when we get the referral, we do tell them if they have a doctor, which plan the doctor accepts. If they don't have a doctor, they can go either way. Help me find a doctor first and then a plan, or I want this plan, and then we find a doctor who accepts that plan in their area. So in Bexar County, the STAR plans, which are regular Medicaid, is the Aetna Better Health, AmeriGroup, Community First, and the Superior Healthcare Plan. Statewide for dental, so this is all of Texas, DentaQuest, MCNA, and United Healthcare Dental. And then the STAR Kids and STAR Plus do have other ones. And so we'll go over those in just a little bit. So here are the STAR for Hidalgo County, which is Driscoll, Molina, Superior, and United Healthcare Community Plan. And then again, the same 3 dental plans, that's statewide. For STAR, and this is in the Central Texas, and I don't think I need to go over all of them, so I'm just going to kind of scroll through these. So I'll just say Central Texas, AmeriGroup, White Care from Scott, White Health Plan, Superior, and then the same 3. And then the Rural West, AmeriGroup, First Care, and Superior. Nueces, Driscoll Health Plan, Superior, and United Healthcare. Region 8 covers all of these areas that I just went over. And we do have outreach in all of these areas. And then this is just a map of everybody and what area you're in. So if you look at Bexar County, we've got all of this, and then we've got some of the surrounding counties, like we've got Guadalupe, Mercer West, which does include, I couldn't even tell you right now what Mercer West does since I don't cover that one, but we do cover almost all of them. Now, if you look at STAR Plus, they are different as well as far as what they have. And again, STAR Plus is for adults on disability Medicaid. So what exactly is STAR? What is the STAR program? It is called the State of Texas Access Reform. The Medicaid Managed Care Program, the goal is to increase access and to improve the quality of care and reduce the cost for medical care. To choose a medical plan and a main doctor called the primary care. Doctor, nurse, or clinic, the primary care provider or main doctor provides is considered the medical home and knows all the information about their clients or their patients. The role of the enrollment broker, which is us, is to educate people who've applied for Medicaid and the Medicaid recipients about the Texas STAR program, to enroll all approved Medicaid recipients within the designated timeframes, and to ensure the recipients are aware of their rights and responsibilities as members of a STAR plan. We are also, we provide support during and after the enrollment process. So we do get calls on our work cell number. Sometimes if something didn't work out, they can call us and we can assist them, or at least provide them in the direction they need to go to. And then to help with a plan change. Maybe they changed doctors or their doctor left, and now the doctor takes a different healthcare plan. We can do that change for them. And then to provide field staff to help complete the healthcare orientations. Who must join? The Texas STAR program is mandated for most types of Medicaid, such as newborns, temporary assistance related recipients, pregnant women, children receiving Medicaid, refugees receiving regular children's Medicaid, former foster care up to the age of 21 or through 25. Recipients unable to join are Medicaid recipients that are in an institution, medically needy, foster children. They are on a STAR health plan, but it's not our STAR. They're on one specific plan. Refugees receiving refugee medical assistance, and then dual eligible Medicaid recipients. These are people that are on Medicare and Medicaid, and they have the option to be on a STAR plan. It's not a must. They have that choice. And then the enrollment process, each approved recipient will receive an enrollment kit. Lots of times we get a hold of them before they receive their enrollment kit. So once we do that, if we get a hold of them first, lots of times I'll get, oh yeah, I have that, but I haven't done it. So I'll say, let's do it right now. Have you had a chance to look? No, well, let's go over it, and we'll do it right there, because chances are they'll forget again, they'll put it aside and not get to it. So we'd rather just go ahead and do it right there and get all their questions answered. And they do appreciate that. And that's something I hear a lot is, oh, you saved me a big headache from having to worry about this. So they will get an enrollment letter or a welcome letter rather. They get the brochures, and I'll kind of display those at the end if I can show them up. The enrollment form, which gives them different ways to enroll, whether it be a phone call, on the internet, and they can also fax it in. Special healthcare needs, and that's if there are more complex medical issues. Comparison chart, which is a list of all the healthcare plans and what they offer. MCO report cards, outreach enrollment assistance sites, and the postage paid envelope. So they can just fill it out, put it in that envelope, and put it right back in the mail. Again, sometimes before in the past, I'd go to home visit and I'd see that packet sitting under a big stack of mail, and I'm like, that's what I'm talking about. We need to pull that out. So how to join by mail. The recipient can complete the enrollment form included in the kit and return it in the prepaid envelope. They must pick a plan and a first and second choice primary care. And the form must be signed and dated. Again, if I do it over the telephone with them, they don't have to do any of this. We take care of it right there. By phone, the recipient can call STAR, and we are available Monday through Friday, 8 to 6 at the 1-800-964-2777. And somebody will assist them and get that enrollment taken care of for them. Online with the Your Texas Benefits, which is www.yourtexasbenefits.com. From the home page, they log in. They'll click on the Medicaid and CHIP services, and then it'll say pick your healthcare plan. I don't know if this is on here, but they can also download a Medicaid ID card right off of their app. And we do encourage them to create an account with the Texas Benefits because they have everything right at their access. So they also can speak to one of us, one of the outreach counselors during a presentation. Sometimes I'll get somebody come up and say, you know what, I have this plan. I just talked to somebody, I'd rather have this plan. We can take care of it right there as well. Also speak with an outreach counselor during health fairs or enrollment events. We do enrollment events as well. Again, that is kind of put on hold. And then outreach counselors contact recipients through home visits and phone. And right now it is just phone. And when must the recipient join? Most of the mandatory recipients must join within 15 to 45 days of their certification date. So once they get that letter saying they're certified, a couple of days have already passed because of mail time. So when we get a hold of them, sometimes that deadline is creeping up. The pregnant women must join within 15 days of their application date. So there's a difference there between regular traditional or regular children's Medicaid and the pregnancy Medicaid. For most STAR recipients, enroll will be effective 15 to 45. Okay, we did that already. If the recipient still hasn't joined or been contacted, say they missed their phone call and they don't get back with us after the deadline, a plan and a main doctor is chosen for them. And, you know, we do try to avoid that because sometimes the doctor doesn't accept the plan. That wasn't the doctor they wanted, and they still have to call in to get that changed over. So we try really hard to get a hold of them through phone calls. Now, how do recipients access care? Before joining in the STAR program, the recipient is on regular traditional Medicaid, and they go to their doctor as normal. Once the recipient is enrolled and it's effective, they can access their care through their medical plan. So again, they'll have a one-stop shop where they can call their healthcare plan and get some questions answered, switch doctors, find a doctor in their area. They should take their Texas Medicaid ID card and their card from their healthcare plan to the doctor, and the pharmacy, and of course the dentist if they're on a dental plan. So when they're on STAR, no limit on medications for adults. Again, traditional, it's 3. Primary care providers or main doctors are ready 24/7. They all have a nurse line available 24/7. No limit on needed days in the hospital. So our pregnant women, sometimes when they're in the hospital, they want to get them out right away. If the doctor wants them to stay a little longer, and I'm talking about regular insurance, sometimes they want you out right away. On a STAR plan, there's no limit. Plans might offer the value-added services, which are some of them are great benefits. And each medical plan has a customer service helpline for their members. And all the members will receive a welcome packet from their medical plan that will include their ID card and facts about the primary care provider and their main doctor. Now I'm going to take a brief pause in case anybody has any questions thus far.
So I do see a question in the chat, Ms. Godoy.
Okay.
She's saying her daughter's 13. She's in the 6th grade.
Okay.
No cuenta con servicios médicos y yo tampoco. I guess they don't qualify for the program, her and her daughter.
Okay.
Because I don't have a Social Security number. Does this have a cost?
A cost for the Social Security card?
No, for the Medicaid.
It doesn't cost her. So what I'd like to do is give her my phone number because I don't want to ask too many questions of her. The reason for this not having a Social Security number and that kind of thing is, you know, kind of private. We don't want to get into HIPAA violation. So she can certainly call me after we're done, and I can go over with her. So I'm understanding that her daughter or herself doesn't have a Social Security number.
Correct.
Okay, yeah, definitely I can talk to her about what the situation is with that, because there might be different reasons why that's happening. And of course, that's going to be a personal, you know, it's not a one blanket statement. It depends on her situation.
Correct. And I
so
believe she can direct message you or me with her information.
Okay.
Okay.
Yes, I put my email address on there as well, and she can list her phone number, and I'll be more than happy to call her.
Perfect. Thank you.
Of course. Anything else before we move on? Okay, so if somebody needs to change their primary care doctor, once they are on a plan, they do have to call their healthcare plan to change the provider. They can call the Medicaid enrollment helpline also to change the plan, or us with STAR. So the number again to STAR is 1-800-964-2777. The plan can take days before it is effective. So that's something they do need to be aware of. And usually the doctor can go ahead and still see them until that plan is changed over. And again, if there's any specific questions about their specific, I'll be more than happy to talk with them. Non-referral services. So these are services that don't need a referral. They might obtain these services without a referral from the primary care provider. Emergency services. I want to say hi to the little boy here. That looks like my grandson. Behavioral health, OBGYN, vision checkups. So everybody on Medicaid does have vision. Texas Health Steps medical checkup. If the primary doctor cannot do it, then they would call the Texas Health Step number, and they would help them find a doctor that can do that. Texas Health Step dental. Oral surgery might require referral through a main doctor. So again, depending on that part as far as the surgery. What's different on pregnancy cases? Pregnant women must join within 15 days from the notice of application. So the time they put in their application, they must enroll within 15 days. We get that referral right away as soon as they put in that application. Women in their third trimester can keep seeing their current OBG. A provider must be a Medicaid provider, and they must tell their medical plan. So if they're already seeing a doctor, they should tell that client, this is the recipient rather, this is the healthcare plan that we take and that they do accept Medicaid. If they don't accept Medicaid, then the Medicaid won't pay for that bill. Newborns to a STAR mother are automatically placed on a mother's medical plan. So I kind of want to go over this a little bit because that sounds like it's just going to happen. The mother still has to call into 211, option 2, or they can report that they had the baby on the app. And then they're going to call their healthcare plan because the baby will follow the mother's healthcare plan. And if they find a pediatrician, though, that takes a different healthcare plan, they could call a STAR or, one of their outreach, and we could change the baby's plan once the baby's at least 3 months old. Because once they report the baby, get the baby on a healthcare plan, it does take about that long to get everything situated. And then we can change the baby's plan to that pediatrician. That doesn't mean the pediatrician won't see the baby. That pediatrician will. It's just that's how long it takes to get that changeover. Children's Medicaid and dental services. Some of this might be a repeat, so if I see it is, I'll just kind of do it real quick. So I did talk about that. Children ages 20 and younger would have dental. They have to have a dental plan and also a main dentist, and we do that the same way that we do with the medical part. How does the enrollment process start? Same thing. Each approved recipient will receive their letter, the welcome letter, tell them to pick the plan they want, and then also the dentist. That sheet is a little purple sheet, whereas the medical one is a blue. Outreach enrollment assistant schedule is in pink. That has been on hold because we're no longer at the sites. Pre-COVID, we would go out to some sites, and all of the HHSC's offices would have a pink schedule to let recipients know when we would be there on site so we could do the enrollment right there. Now, with that being said, some of us, including myself, have left our cards at the offices. So when they do have a person that is enrolled or that just got certified for Medicaid, they can call us directly on our work cell numbers. And so the dental services that are covered, the same Medicaid coverage dental benefits they get now, the checkups, the cleanings, exams, sealants, oral health education, follow-up services, the extra services offered by the dental plan called added value added services, and the dental plan helplines. No changes for some people with Medicaid age 21 and younger. If there's people of any age living in a Medicaid paid nursing home, state supported living center, or ICF IID, and then children and young adults in the state foster care program who are in the STAR Health program. The main dentist, of course, is a general dentist or a pediatric dentist. We do have, where we can tell them this is a pediatric dentist because some of them do prefer that for the children. Providers must, most of the dental healthcare needs, the providers provides most of the dental healthcare needs, gets to know the child's history, and then can refer to a specialist. When we're looking at our charts of dentists, it does give us the age group. So if somebody's looking for a dentist that takes newborns, our chart that has the dentist will show starting at birth through age 99, or birth through age 12, or starting at age 12 through etc. So that's very helpful. And their dental plan will have that same information. So people ask, can I see a specialist? The main dentist will help with most of the dental care. The main dentist will refer if a referral is needed, and the dental plan might have to approve the referral first. So always check with your healthcare plan and also with the main dentist. You'll get a dental plan ID card. They would need to call the dentist, call the dental plan to change their main dentist. Again, this happens, when the person defaults and their dentist is assigned to them, they'll have to call and get that dentist changed over, and then call the STAR helpline if they need to change the dental plan. Once the plan is chosen, we can't change the dentist. They have to go through the plan, but we can change the plan. And if we change the plan, then we can add the new dentist because we're doing a new enrollment. Did that make sense? Did I go too fast on that?
Yes, it makes sense.
Okay. Healthy Texas Women. This I like for our college gals. This is, it provides low-income women for their annual, so their PAP exams, their mammograms, their screenings, birth control. A lot of this age group does not have insurance. They may have aged out of their parents. They're students, so they don't have any medical coverage. This at least covers those important medical issues. Healthy women participants do not receive full Medicaid benefits. As a result, they are unable to join a managed care, so they don't get STAR, and they're unable to get services through Texas Health Steps. This is for ages 15 to age 45 that don't have any kind of coverage, don't qualify for Medicaid or CHIP, but do meet an income limit for the Texas Healthy Women, but it is limited to those services. For those who wish to apply or have questions about these benefits, they can call 1-866-993-9972. If somebody already has the Healthy Texas Women and needs help finding a provider, they would call 1-800-335-8957 and option 5. And then the website is there, www.healthytexaswomen.org. They can also apply on www.yourtexasbenefits for the Texas Healthy Women. So again, here it is. The program is for women between the ages of 15 and 44. I said that incorrectly, so I stand corrected because it's through their 45th birthday, so they will not get that at 45. Between the ages of 15 and 17, they do need parental consent. U.S. citizen or an approved immigrants, 200% of the federal poverty level, not pregnant, because if they're pregnant, they don't need the birth control, and they can possibly get the pregnancy Medicaid. And then the eligibility determination, the client eligibility is determined by the Health and Human Service Commission. They can apply through a paper application or line, services delivered on a fee-for-service basis. So the Texas Healthy Women includes, I'm sorry, this is not the Texas Healthy Women. This is the family planning. There are not a whole lot of clinics that have this, but if they did have questions, I'll go over that. But the eligibility is for women and men age 64 or younger with 250% of the federal poverty level. Texas residents must be unable to get any similar program, including the Healthy Texas Women fee-for-service. Eligibility is decided at the point of service by family planning contractors, and it is covered their pelvic exams, contraceptives, PAPs, screening for hypertension and diabetes, sexually transmitted diseases, sterilization, breast and cervical cancer screenings, immunizations, and limited prenatal services. So another service that is provided for those that don't have anything. And then here are the different websites, the Health and Human Service Commission, HHSC, the Texas Health Step, and then of course the providers, and then literature. And again, this is all going to be on the YouTube recording. And here is our management, the Texas Health and Human Service Commissions. We are contracted with the state. Denham Olden is our regional manager, and Christy Wozenak is our supervisor. And we have any questions?